Greetings, I'm Dr. Matt Preventure from the Stebbing Clinic in Vail, Colorado. Well, today I'm highlighting our paper titled Tibiofemoral Load Sharing and Lateral Meniscus Function are Restored in Tibia and Capsular-Based Repair of Type 3 Lateral Meniscus Oblique Radial Tears. In this study, we evaluated how Type 3 lateral meniscus oblique radial tears affect knee joint mechanics and whether different repair techniques can try to restore normal function. Well, what do we find? Our main takeaway is that repairing these tears with a tibia-based anchor or a capsular side-to-side technique effectively restores normal knee kinematics. But leaving them untreated or simply debriding them is not very good and really can alter the long-term kinematics. Well, this reinforces the importance of repairing these tears at the time of ACL reconstruction or just in general to preserve joint function and potentially improve long-term outcomes. I truly want to thank all of my co-authors because this would not be possible without them. Tyler Upstrom, Justin Hollenbeck, Taylor Calibro, Colin Murphy, Tyler Perberg, Mark Sinke, Jason Sidirek, and Dr. John Godin. They all did such excellent work, and we look forward to doing more studies on such important topics like this. And lastly, I want to thank the AJSM editorial team, the editorial board, and staff for their assistance. Thanks again.